Knock. Hi, I'm Nicki. I'll be the nurse practitioner student doing the head to toe today. Is it okay if we run through this today?
Yeah.
Great. I want to step out real quick, wash my hands. While I'm out, go ahead and remove your shirt so we can go ahead and get through the lung and heart assessment. Great. Okay?
Okay.
Great. I'll be right back. All right. To start, let's go ahead and start with your name and where you're at.
Stephen Simpson, Research Medical Center.
And can you tell me what year it is?
2018.
Patient is alert and oriented to self, place, and year. Appears dressed appropriately for the season. It is summer. Also appears appropriately dressed for age and developmental or age and situation. Mood and affect are congruent, and speech is clear and appropriate. Upon inspection of the face, it appears to be intact and symmetrical at this point. Go ahead and raise your eyebrows for me and close your eyes real tight. Don't let me open them. And smile. Buff out your cheeks. That was assessing cranial nerve number 7, the facial nerve. And we'll assess cranial nerve number 12 with the tongue straight. Go ahead and push your tongue against your cheek. And your other side. Good. Tongue is equal strong bilateral. And go ahead and say ah. Open your mouth real long. And stick your tongue out. Good. Uvula is midline. No atrophy noted of the tongue or gingiva. The teeth appear to be in good hygiene. And moist, clean, intact mucosa is present. Now, have you had any issues with your taste or your hearing?
Nope.
What about your swallow?
Nope.
Go ahead and swallow for me. Upon inspection of the neck, trachea appears to be midline. I'll go ahead and palpate for any tenderness, swelling, or nodules, or asymmetry. No nodules or asymmetry noted of the scalp. Patient is normal cephalic. No tenderness noted. And we'll check out your sinuses, see if there's any sinus tenderness. Any tenderness?
Nope.
Good. We'll go ahead and also check out your hearing. I'll see a number or a word. Just repeat what I say as I whisper.
7.
Good.
9.
Good. Patient able to vocalize appropriate word upon me voicing the word or number. Now we'll move on to finishing out your trigeminal nerve assessment on the sensation. So we'll move on to the sharp or soft assessment and also proprioception assessment. I will either have this be the soft or this be the sharp. You tell me what location and if it's soft or sharp.
Okay.
Okay? So go ahead and close your eyes.
Soft cheek. Sharp forehead. Soft forehead. Sharp cheek. Soft cheek. Sharp arm. Soft arm. Sharp hand. Soft hand. Sharp shin. Soft shin. Soft foot. Sharp foot. Sharp other foot.
Left or right?
Left.
Good. And while I'm down here, you can go ahead and open your eyes. I'm assessing for the hair distribution, swelling, any discoloration in your skin, and we'll go ahead and assess your skin turgor of your feet. And your skin turgor of your feet, again, is less than 1 second, and your cap refill is less than 3 seconds. No signs of cyanosis, clubbing of the toenails or the toes themselves. Your toes appear well groomed, intact. No discoloration, purpura, ecchymosis, or skin breakdown noted. No swelling noted of the lower extremities. Hair distribution appears equal bilateral, again on upper and lower extremities, as well as anterior torso and the face. And while we're up here at the face, I'm going to go ahead and take a peek in your eyes. Go ahead and look up for me. And look down. Good. Your sclera appears clean, moist, white, intact. Conjunctiva has no signs of swelling, drainage, or nodules or cysts noted. And I'm gonna go ahead and take a look at your nose here. Septum is midline. Nasal cavities are equal bilateral with no abnormal drainage. Again, septum is midline. Again, cavities equal bilateral, no abnormal drainage. Checking for sclera and the conjunctiva. Sclera again is white, intact, no drainage noted, no ecchymosis or nodules or cysts. Now we're almost done with our cranial nerve assessment. We'll go ahead and assess your sternocleidomastoid and your shoulder shrug. Go ahead and have you turn your neck that way and press against my hand and your other one. Good. And shrug your shoulders up. Good. Patient has strong bilateral sternocleidomastoid as well as strong shoulder shrug. Cranial nerve 8 is intact for the hearing. And your swallow, again, all cranial nerves have now been assessed except for your eyes here. We'll finish out with your pen line. I'll have the measurement here of 6 bilateral and follow my pen light and checking for accommodation. And now we'll assess all visual fields. This is 3, 4, and 6 cranial nerve. Good. Now we'll check for visual field. Do you have any contacts or glasses you wear?
Contacts.
Do you have them in?
Mm-hmm.
Good. I'll go ahead and cover your left eye. And how many fingers am I holding up? Look directly at me.
2, 3, 1, 3, 2, 2,
Okay. Now we'll do your other eye. Look directly at me.
2, 1, 3.
Good. All right, that was optic nerve 2, cranial nerve we assessed. I'll go ahead and check one more time for your pupil response. Pupils are congruent and consensual. Pupils are equal, round, and reactive to light as well. Now we will assess your breathing now that we've completed our cranial nerves. And upon inspection of the chest and thorax, chest is symmetric, raises upon inspiration, no protrusions or barrel chest indicative of any chronic disease like COPD are noted. Patient does not appear to be in distress during respirations. Respirations are equal. Respirations are 18 as well. I'll go ahead and take a listen to you. No signs of accessory muscles are being used. Big deep breath in and out. Good. Anterior, upper, and lower lungs bilateral are clear. No adventitious lung sounds heard, no wheezing, coarse rales, or crackles noted. I'll go ahead and listen and inspect the back now. Have you swing your legs for the purpose of the video for the back. And upon inspection of the back, no asymmetry, protrusions, or abnormalities noted. Chest and thorax are symmetrical, and hair distribution is equal bilateral. Go ahead and take a listen to you here. Big deep breath. Deep breath. And again. And again. And again. And again. Good. Lung sounds are clear, upper and lower bilateral, no adventitious lung sounds noted, no crackles, coarseness, wheezing, or rales noted as well. While we're back here, I'm just going to palpate and check for any tenderness, nodules, swelling, anything else I could find on assessment. Any tenderness?
No.
Any pain?
Nope.
Cervicals are spaced appropriately, no nodules or asymmetry noted. No discomfort noted. Okay, for purpose of the video, go ahead and swing your legs back around. Good. And we'll do the same thing for the front, assess for any tenderness for the front here. Any tenderness?
Nope.
Still no tenderness?
Nope.
Good. No abnormal movement, bulging, masses, tenderness, or swelling noted upon palpation of the chest. So now we'll go ahead and move to your heart. Take a listen to your heart. Have you lean forward for me? S1 and S2 are heard at the apical area of the heart. Go ahead and have you lay down on your left side too. Okay, listen here at Herb's Point. S1 and S2 are present. No clicks, rubs, murmurs, gallops, and the apex for a full minute. Heart rate is equal. Regular. Pulse is 68. Strong. S1 and S2 are present. No clicks, rubs. S4, S3, or murmurs noted. Go ahead and sit up for me. So we've done your lungs, we've done your heart. We're going to go ahead and move to your range of motion and your strength. So while you're sitting up, we'll go ahead and test your upper body, okay? So go ahead and make a T for me. I'll push down and pull up. And then go ahead and pronate or put your palms down and rotate up. And wiggle your wrist for me. Good. Now put your palms up and down. And again, up and down. No crepitus, heat, or any discomfort?
Nope.
No discomfort noted. And I'll have you push against my hands. And don't let me pull back. We'll do the same thing. Go ahead and squeeze my hands. Good. Strength equals strong bilateral and open. And go ahead and bend your arm in this motion. No crepitus, heat, or swelling noted. And we'll do this joint here as well. And again, no crepitus, heat, swelling noted. Good. Now, we'll have you curl it just one more time. And don't let me push and don't let me pull. Good. No lag or weakness in either extremity. Strength is equal bilateral in arms, wrists, and shoulders. Now we'll go ahead and have you lay back down. And we'll do your abdominal assessment here. And then we'll check for your range of motion in your neck when we sit back up. Upon assessment of the abdomen on inspection, no masses, pulsations, or peristalsis are noted. Abdomen is symmetric, flat, and hair again distributed equally bilateral. No swelling noted. Go ahead and listen to all four quads. Vowel sounds regular, equal, and all four quads. Any tenderness or pain in your stomach you know about?
Nope.
I'm going to lightly inspect and palpate and then deep. Let me know if you have any tenderness.
Okay.
Here's a light palpation. Any tenderness?
Nope.
And now a deep palpation. Good. Any issues with your stomach?
Nope.
When I deep palpated, good. How about bowel movements? Diarrhea, constipation?
Nope, none of that.
Any urination problems? Frequency, urgency, good. And while I have you in this position, we'll go ahead and do some active range of motion for your lower extremities. And I'll go ahead and have you push your toes towards your knees. Good, equal strong bilateral. And again, push down. Good, equal strong bilateral. Any pain in your ankles?
Nope.
Go ahead and flip your toes up and down again. And your feet, good. No crepitus, no heat, no swelling noted bilateral. Now I'll have you crisscross your feet. Good. And the other side? Any hip pain?
Nope.
Good. Go ahead and uncross. I'm going to have you take this leg and abduct it or take it out away from the bed. All right, and back in. Now I'll have you lift it straight up. Good. Put it back down. Now bend your knee and bring it up to your chest. Good. We're going to do the same with your other leg. No crepitus noted, no swelling, no tenderness, and no heat. Patient able to perform all range of motion on the right leg thus far. Now we'll do your left leg, do the same thing. Go ahead and abduct and take it away from the bed. Good. And straight up. Good. And bring your knee to chest. Good. No crepitus, swelling, or discomfort noted on the joints. Patient able to perform range of motion. And while you're here, we're going to check out your pulses. Have you lay down here, check your carotid, and your brachial, and your radial, your femoral, your popliteal, your tibialis, and your dorsalis pedis. Patient's pulses are equal strung bilateral +2 regular rate and rhythm. And now I'll go ahead and have you sit up at the edge of the bed. We'll check your range of motion for your neck. So I'll have you go side to side, shoulder to shoulder. Good. Now ear to shoulder. Any pain? And now front to back. Any pain?
Nope.
Good. No crepitus, no swelling or tenderness noted on range of motion for the neck. Now, I think we have finished our head to toe assessment. One last thing though, we just need to watch you walk. So I'll have you stand up, we'll assess your gait. Have you take a couple steps forward for me, 2 or 3 steps, assessing for any unsteadiness. Patient gait is smooth, steady, no signs of balance issues. And I believe that concludes our head to toe. We've ran through your neck and cranial nerves as well as your hearing, taste, smell, your skin, and your peripherals. Like I said, no ecchymosis, no purpura have been noted on your skin. No laceration, skin breakdown, skin is intact. And your heart sounds great. S1 and S2 are heard. No abnormalities, murmurs, or clicks. Your lungs are clear, diminished, anterior and posterior. Your range of motion is equal bilateral as well as your strength, able to perform all range of motion in upper and lower. And I think that concludes our head to toe assessment. Do you have any questions for me?
Nope.
Okay, well we will see you here shortly. Thank you.
Thank you.